Thanks so much for being with us. So since the news broke on Friday that Roe v. Wade had been overturned by the U.S. Supreme Court, there has been dismay and anger, and I would even say concern that our rights here in Canada might be compromised. We think of Canada as a place where it's easy to get a safe and even free abortion, yet access can be an issue in Canada, especially in more rural areas. Kemlin Nembhard is Interim Executive Director of the Women's Health Clinic in Winnipeg, and she joins us now. Thank you for your time today, Kemlin.
Thank you.
So maybe you can start by telling us about the kind of work you do at the Women's Health Clinic.
Yep. So, we do a full gamut of sexual and reproductive health, predominantly women, people who identify as women, people who are genderqueer, non-binary, individuals. And so we do everything from, we have a birthing center, we do abortion care, we have primary care. We also have a counseling program, a free counseling program, eating disorder program.
Wow.
We do
So
have a variety.
lot.
We also have family programming. We have, things for new families. We also have a program for people that have had a loss of a child as well, whether that's through a miscarriage or, or if they've lost a child, at a really young age. So we have a really full gamut of services that we provide.
That's amazing. That's amazing. I think, we knew obviously the possibility that Roe v. Wade would be struck down with those leaked documents. And I think we were prepared to some degree that it might happen. But when it actually happened, I feel like for everybody, it just felt like a giant slap across the face. Like it was somehow shocking, even though we saw it coming. What's your personal reaction to Roe v. Wade being struck down?
Oh, well, a shock is a good place to start.
Mm-hmm.
Appalled, just, it's disbelief. I can't believe that we're in the 21st century and we're having to have this conversation again. Just anger, lots of anger, frustration. And I think, and it's not even in my own country, right? Mm-hmm. I just think, there's just so many different emotions. Like I go through different emotions at different points. And I think also, fear is one of them in terms of not so much that I think it will necessarily impact whether it's going to be still legal here in Canada, but more what the impact of that rhetoric will have on our political discourse in Canada, and the impact that will also have in a very real sense in terms of safety for people who provide abortions, right?
Mm-hmm.
Long before this, we constantly get people protesting in front, like anti-abortion activists protesting in front of our sites. And, that's been going on every year for, as long as even before we provided abortions in our clinic, but we were always pro-choice and gave referrals.
Mm-hmm.
Even then, we were getting protesters. Now, what worries me is, are people going to go farther,
mm-hmm.
right? So that is a real worry for me.
Yeah, I think that's completely valid. I mean, that people would feel emboldened by this. And I think here in Montreal, we don't tend to think about access, Kemlin, like most large cities, right? The resources are there. But it's a very different reality elsewhere, right? Like I talked about rural Canada, and I think it varies greatly. So tell us a little bit about what is the overall situation for abortions in Canada?
Well, again, like you said, if you live in rural or northern communities, you are really access is very patchy, right? And certainly not for surgical abortions. So as an example, we are in Winnipeg. We actually provide abortions to people not just in Winnipeg, but all over the province, as well as northwestern Ontario and Saskatchewan, and even northern U.S.
Well, that tells you a lot. Right there.
Yeah, and so that in itself is telling. I mean, there are some jurisdictions like Nunavut. There's nowhere to get an abortion in the territory, as far as I know. So people have to leave the territory to actually get access to that care. And then, when you think about access, it's not just about not having it in your community. It's how much that makes it, how difficult it makes it, right? So people have to travel hundreds or thousands of kilometers to be able to access a service that we should all have an equal access to. Mm-hmm. They have to pay for their travel. They have to pay for their stay, pay for their time away from work, figure out what, if they have children, figure out childcare. Like, there's so many different things that they also need to deal with that costs money and time that if you live in an urban center that has access, you don't need to deal with. But that also creates barriers for people. And quite frankly, those barriers are more strongly felt by people who are already marginalized, often people who are racialized, Indigenous people who often don't have as many resources, right? And so it's just putting more and more barriers in people's way of being able to get the care that we all have a right to and that we should all have equal access to, no matter where we are, no matter what our circumstances are.
I was thinking, too, it's a very private matter. It's a very private, personal matter, and somehow lack of access takes part of that away as well. Yes,
and that is also part of the challenge in terms of access is that when I look at, I know the situation in Manitoba the best, and I know in Manitoba there are actually quite a few physicians that are trained to provide medication abortion, because it's something that a physician can, a primary care physician can do that. Your gynecologist can do that. You don't need to come, if you're getting a medication abortion, you don't need to come to, like a place like us that actually also provides surgical abortions.
So just to quickly explain that, a medication abortion is literally like a series of pills that you take that would induce an abortion, right? Okay.
So, and it's basically like having a miscarriage. And, there are tests you need to have, so you need like blood tests, probably just to figure out how far ahead you are in terms of your gestation. And then we also, doctors also like to follow up with a patient to make sure that everything has gone well,
sure.
Right? So, but part of the access with that is that it is still not safe for practitioners to be really open about being abortion providers. Mm-hmm. And so there are lots of abortion providers who provide, can provide medication abortion in rural or northern communities, but they don't publicize that because it's not safe. It's not safe for them. It's not safe for their families, right? And that in itself provides a barrier to access. The other piece is, like you said, there is still this, unreasonable stigma about seeking abortion care. And so people, even if there is an abortion provider in their community, they may not want to go or even approach somebody and want to ask them in their community if it's a small community, or even go to the pharmacy in a small community,
sure.
Right? Because of that stigma. And that also is a barrier to access.
So there's still work to do.
Lots of work.
I mean, I think there's a lot of women feeling very grateful to be Canadian, but that doesn't mean that there isn't room for improvement. Kemlin, thank you so much for your time today, and just keep up the great work that you're clearly doing in Winnipeg.
Thank you very much for the time.